Hey everybody, in the last video we talked about neuroinflammation and in particular how neuroinflammation can lead you to experiencing cognitive type complaints such as memory loss or brain fog or just not feeling as sharp. And then we left off when we started talking about microglial priming. And so that's kind of what this video is talking about. And I had a kind of a hard time trying to decide what I wanted the title of this video to be, but I settled on total loss of function after trivial stressors, because that's the type of complaints that somebody is going to present with if they do get into this microglial priming stage. So my name is Dr. Matthew Shem. I'm the owner of Peak Brain Performance Centers here in Colorado Springs. And like I said, in the last video, we talked about how there's two different types of cells in the brain. We have neurons, which pretty much everybody knows about, and then we have glial cells. And glial cells are the more prominent types of cells in the brain, and they're kind of responsible for helping out various jobs for the neurons and stuff like that. But we also talked about each individual glial cell, and then for the sakes of this video, we're going to really touch on the microglial cell, and the microglial being that cell that kind of scavenges around the brain and makes sure that all this debris is cleaned up and stuff like that, so that we can function appropriately. And it also helps with various things for neurons to be able to do the things that they need to do. So similar, the example that I gave in the last video is similar to you going out and trimming a tree and getting rid of all the dead branches and stuff like that. Same thing in regards to the microglia, is they go around and scavenge and they pick up all the debris so that we can have a normal, healthy, functioning nervous system. What we also talked about in the last video is how microglia are really, really important in the fact that whenever you have this neuroinflammation in the brain, microglia are responsible for making the antioxidants in the brain that's going to combat that inflammation. However, under chronic inflammatory conditions in the brain, these microglia become depleted. So now we have this perpetuous cycle where this inflammation, it just keeps on building and building, and the antioxidants, the things that make the antioxidants, are being depleted. So you can see how this people that typically present to my office with these types of complaints, I ask them, do you notice yourself getting progressively worse, about the same, or better? And typically they just continually getting worse. And this may be one mechanism right here as to why they're not noticing any improvement, because they're not doing the appropriate things to get these microglia and the inflammatory aspect under control. And this just leads to a perpetuous cycle of you're feeling less cognitively sharp and more brain fog and all these other things. So we talked about, we left off in the last video talking about, are your microglia primed? And again, we talked about how these microglia are really, really important, because if you see on the left-hand side that microglia with all those little branches, let's think about those little branches like feet. And those little feet allow this microglia to move around in the brain and kind of make sure that it's looking for all this different debris so it can kind of scavenge and clean up everything where it's necessary. And we're going to call that an M0 state. Now, whenever microglia become primed, they go into an M1 or M2 state. And do you see how there's a different shape of the actual microglia from the left-hand side to the right-hand side? You see how the feet are not as prominent anymore. And this is a problem with whenever microglia become primed, because they lose their branches, they lose their legs, and so now they're stuck sitting in one particular area, just scavenging in that one area, instead of searching around for all the debris throughout the brain. And so you can imagine how whenever you do have microglia that become primed, our goal as a healthcare team, you and I working together, or whoever it is that you're working with, is to get you from that M1 state where you're driving these inflammatory aspects in your brain to an anti-inflammatory in the M2 state. So what is an actual primed microglia? In this article, they described it as an exaggerated response to a secondary insult such as a repeated TBI, immune challenge, or stress, which we'll talk about in a minute. There's a bunch of different things that can cause primed microglia. And this results in amplified and prolonged neuroinflammation that negatively influences cognitive and behavioral processes. So what you'll typically see is somebody with primed microglia, they're going to present with a chief complaint of saying there was this rather trivial stressor, like maybe I didn't get a full 8 hours of sleep, maybe I was around somebody with some strong perfume, maybe I ate a piece of bread. There's all these different things. Maybe I got into an argument with my husband, all these different things that can lead into just being what you would consider with somebody with a healthy brain to just be rather trivial types of stressors, things that you wouldn't think second about. Something that if I know for me, if I didn't get a full 8 hours of sleep, I may feel tired the next day. But if I had primed microglia, what's going to happen is I'm going to basically lose all function and I'm not going to be able to function. I'm going to have things such as I may feel really depressed. I may feel an excessive amount of cognitive decline where I just can't do anything. I have no motivation to do anything. I may feel uncoordinated and dizzy. I may start noticing some personality changes. A perfect example is a woman that I saw just a couple of days ago, and she was giving me an example of how when just these rather trivial things, like she doesn't get enough sleep, affects her, it's very frustrating for her to be able to explain to her husband, because her husband doesn't have primed microglia and he doesn't have a history of head injuries like she does. And so it's very frustrating for the relationship. And so now you can imagine how that added stressor of her husband not understanding her condition is also something else that adds to these added stressors to make her to where she's now going to experience these different changes. And so you may feel things similar to maybe you feel just really weak, or you have just a complete loss of function of one side of your body, or changes in difficulty finding your words. There's all these different things that could happen from these rather trivial things. So what causes actual microglia priming? And an example that I give to a lot of my patients is this example of a bucket of water, right? And so whenever we have symptoms that, or let's imagine that our symptoms are like water in a bucket. And whenever all these different symptoms start adding up, whenever that bucket starts to overflow, such as the bucket on the right, that's when we start noticing symptoms, whether that be feeling depressed, maybe that's anxiousness, maybe you're feeling some cognitive decline, maybe you got some muscle weakness, maybe you're dizzy, maybe you got a headache, all these different things, whatever it may be, whatever symptom it is that you're dealing with, that is what occurs whenever that water flows over the bucket. And so now it's my job to be able to identify what are all those stressors that's adding into the water in the bucket, tying back to the example of the lady that I just told you about that I saw a couple of days ago, is with her, it could be just a simple stressor, which any typical person with a normal, healthy brain should be able to just brush off as no big deal. But for her, if she already has, let's say, microglial priming, maybe she has a problem with her vestibular system, maybe she has some blood sugar issues, maybe she's anemic, maybe she has an autoimmune condition, all these different things are adding water into the bucket. And so you can imagine that it just really depends on where are we starting from, right? And so when we talk about the causes of microglia, we don't really know when microglia become primed or what would typically lead them to be primed, because it's different for every person. It may be for one person that they had a significant other pass away. Maybe it's somebody else where they got into a car accident. Maybe it's somebody else where they had a UTI. Maybe somebody else they had a some sort of infection. Maybe it's somebody else where they hit their head, but maybe they didn't even hit their head that hard. Or it's just a normal aspect of aging where we do get some of this microglial priming as we age. But can we kind of combat that and keep it at bay for as long as we can so we can live the fullest, healthiest life as possible? So when it comes to what causes this microglial priming, like I said, we don't really know. It could be a number of different things. It could be something rather trivial, but it all depends on what is the resting state of your brain leading up to whatever that inciting event is. So let's say I have a history of diabetes, maybe I'm a smoker, maybe I have a poor diet. All these things are adding water into that bucket, which maybe you feel fine, and then one day you just hit your head, and maybe it's not even that hard of a hit, and you go down like a sack of potatoes, and you start noticing that your life has been changed forever now. That's the typical complaints that you're going to see when somebody has this microglial priming, is they just feel like I underwent this stressor that really shouldn't have been that bad if I was really healthy. But all of a sudden now my life has changed and I have all these symptoms that I have no explanation for. So I hope that you were able to learn something in that video. In the next videos, we're going to talk about what we can do to treat these different types of conditions, whether it be with lifestyle and dietary changes and supplement recommendations, all these various things to help combat these types of issues. And the important thing to know is that it's obviously the earlier, the better in regards to your prognosis of outcomes. Because if you just have a little bit of neuroinflammation, remember how we talked about those microglia and how the shape of them change whenever they become primed. Now, these shapes, once they lose their feet, it's just like if you lose your arm, you're not going to grow back another arm. So same thing here. And that these microglia, whenever they become primed, they don't go back to that resting M1 state or M0 state where they're now scavenging and they have all their legs again. So it's important to be able to monitor these symptoms as they come up and get to the appropriate provider at the earliest convenience. Because once these things change, they typically change forever. And so we want to help manage things before they get severe. So I hope you enjoyed that. And I look forward to seeing you in the next one.